Managing udder health is essential in the dairy industry as udder inflammation and infection, or mastitis, is one of the most prevalent and most costly diseases on dairy farms. One aspect of udder health management is the dry-off procedure. Today we are talking with Dr. Herman Barkema and a couple of his students to discuss the importance of dry-off and recommended strategies. So thank you very much, everybody, for joining me today. So we'll go around and do introductions briefly. So Herman, why don't you start and tell us a little bit about your background and involvement in the dairy industry?
Thank you, Kira. I'm Herman Barkema. I'm a prof in epidemiology of infectious diseases at the UCVM, the University of Calgary Faculty of Veterinary Medicine. I'm an NSERC Industrial Research Chair in Infectious Diseases of Dairy Cattle. That chair is funded, sponsored for quite a bit by the dairy industry. Alberta Milk plays quite a role in that, but all four Western dairy boards, plus Lactanet, DFC, and the Canadian Dairy Network. So we have, and also WestGen of our endowment fund. So there are quite some players that that place trust in our program, and we're very happy to work with these dairy players because, you know, frankly, I feel part of the dairy industry. That's what we do in this program. So what we do in our program is we try to identify together with the dairy industry issues and help solving those. And one of the issues that comes in our direction right now is decreasing the use of antimicrobials, and selective dry cow treatment is one of those. But that's only one of the things we do. We also work on Jony's disease. We work on surveillance of infectious diseases, and we work on mastitis. We have one other project working on detection of clinical mastitis on robot farms, for instance.
All right, thank you very much, Herman. Kaylee, why don't you go next?
So my name is Kaylee McCubbin. I am a veterinarian as well, and I completed my Master's of One Health, and now I work with Herman doing my PhD specifically in selective dry cow therapy and antimicrobial or antibiotic stewardship.
Great, thank you very much. Anna Marika, why don't you go ahead?
So my name is Smid, and I got my PhD at the Animal Welfare Program at the University of British Columbia about a year ago, in 2019. And in that PhD, I studied the preferences of dairy cows for various types of outdoor areas. And currently, I'm a postdoc with Herman, also working on outdoor access for dairy cows, and specifically looking at the moment at the perspectives of Western Canadian dairy producers to the provision of outdoor access for dairy cows. And we're planning a study, an on-farm study, to look at how various types of outdoor areas influence dairy cow health.
Great. Well, thank you, everyone, for joining me today. So I guess let's get into the questions. So the dry-off, the moment of dry-off, can greatly impact udder health of a cow and the production potential of her next lactation. So could you explain a little bit what's going on internally during this process as the cow is drying off and why it's so important to do this properly?
So the dry period is really needed for the udder to restore, so that it will be ready for the next lactation. If you want to know exactly how that goes, you better ask an udder physiologist. But it is really important, and we have looked at how long it needs to be, and because we always talked about 60 days. Well, if it is less than 6 weeks, the production in the next lactation is a lot less. So we cannot just skip the dry period. We really need to have that period for the cow and also for the calf. However, the dry period is also a period where cows don't produce milk, and often get less attention than other cows. If the lactating cows, the stalls are cleaned twice a day, then it's often with the dry cows twice a week. And these animals are really sensitive for infections, for instance, and also the whole nutrition that they get in the dry period is really, really important for the start of the lactation. So a lot of the problems that we see in the beginning of the lactation, particularly with clinical mastitis, can be traced back to the dry period. And we need to understand that when we dry a cow off, it takes a while before the teat canal closes, and then it only closes in about 60 to 70% of the cows. And then we try to protect these cows with dry cow treatment with antibiotics. But this dry cow treatment only works against what we call the gram-positive bacteria. So those are Staph aureus and the streptococci, and not to the gram-negative bacteria like E. coli and Klebsiella. So it is essential that drying off, we do this very hygienically, and when we inject anything in the udder, it be antibiotics, and we'll talk about that later, or an internal teat sealer. Yeah, because if we don't inject an internal teat sealer in a very hygienic way, we bring bacteria like E. coli, which is an environmental in, and we get what we call train wrecks. Cows that get a blown up udder and get an immense mastitis. So again, it's a very important period for the cow, but it also has its risks.
Mm-hmm. Yeah, definitely. It's a very important period. And I think one of the issues out there is that there's so many different strategies and products and things that can be used for the dry off treatment. So could you walk us through a little bit what the research recommends right now in terms of the dry off treatment for cows?
So we always said that every cow needs to be dried off with antibiotics. And that was because we had a very high percentage of cows that had an infection in at least one of the quarters. We get a build-up during the lactation of infections, and the moment of drying off is an excellent moment to treat a cow with antibiotics, because then for 2 months we have not to worry about milk with residues going into the bulk tank. Plus, we can give a high dose of antibiotics at that moment. So that's what was always recommended. But in the last 10, 20 years, the bulk tank somatic cell count has decreased quite a bit, and with it, the percentage of quarters that is infected with bacteria like streptococci and Staph aureus. And so we now have way less quarters infected with these bacteria, and we can consider not treating those cows anymore to get rid of the infections. However, another thing that also dry cow treatment does is prevention of infections in the dry period. So if we don't treat them with antibiotics at drying off, we have to make sure that these cows don't get infected during the dry period. So there two things come in. One is the hygiene of these cows in where they are housed. And like I mentioned before, it is essential that the housing there is very clean, so that they don't get these infections like Klebsiella, Strep uterus, E. coli in that period. But another thing that we try to do now is blocking the teat with an internal teat sealer. And you know, most of that teat sealant will stay in the teeth and will prevent infections coming in. But again, it needs to be done very, very hygienically.
Great. So you talked a little bit about this just in your previous answer, But the difference between a blanket dry cow treatment where everyone's getting treated with antibiotics versus a selective dry cow treatment. So could you talk a little bit more specifically about the differences between these two procedures and what producers need to keep in mind as they're making a choice between one or the other?
So you want to answer that question, Katie?
So essentially, like you said, blanket dry cow therapy is when all cows, all quarters are infused with an antibiotic. They may or not also be infused with a teat sealer at that time as well. Whereas selective dry cow therapy is what, Herman sort of touched on before, identifying cows that either currently have an infection and will require antibiotic treatment at dry off, or are at high risk of developing an infection at dry off. So if you can really, pinpoint these cows and treat them selectively, what we're sort of seeing in the research is that this can be as effective at preserving cattle health and welfare, in comparison to the blanket treatment. So therefore reducing a lot of essentially unnecessary antibiotic use at this time. We know that most antibiotic use on dairy farms is to either prevent or treat mastitis. And if we can reduce that, it's really essential to sort of see what the current recommendations are in the literature, what we're finding, and really, make something that's easy for producers to enact, but also maintains cattle health and welfare as well.
Yeah, and I think that's really important, and especially we'll talk a little bit later about it, but really specifically around the stewardship of antimicrobial usage. So the more strategies we can develop to reduce antimicrobial use, I really think that's going to be beneficial for us long term. So you mentioned a little bit that for producers to identify cows for the selective treatment. So could you speak a little bit more about what they should look for? Is it just somatic cell count? And then you also said identifying cows that are at a higher risk for developing an infection. So could you talk a little bit more about, what producers can do to identify those cows that need selective treatment?
So there's essentially, a couple levels of selection that we can go through. First being herd, essentially appropriateness for selective dry cow therapy. So do they have a low bulk tank somatic cell count? And do they have a low, contagious mastitis prevalence? These are really things that should be considered before essentially approaching selective dry cow therapy as an option for the farm. And then there are essentially two realms, I guess, of selection that are commonly used. So you can look at production data, SCC, somatic cell count data, so certain parameters, or you can look at, doing on-farm culture. So you can look at it from a culturing sense and see if you have culture positive cows, or also consider their previous clinical mastitis history, sort of creating an algorithm for your farm. And the same goes for the SCC method. So you can enact a certain threshold. So say cows who have had, their last 3 SCC reports lower than 200,000 cells per milliliter, no previous cases of mastitis in the lactation, those could be identified as cows who wouldn't necessarily be considered high risk for developing an infection in the dry period. So there are a couple different ways you can do it, and also incorporating, additional clinical mastitis history into your decision making. And there are a lot of different ways that producers will identify what cows to be treated. So sort of the current practices that are enacted in Canada as well.
So if I can just add to that, Lactanet has developed a module to select the cows for dry off. That module has been introduced in Ontario now because of a project they were running there, and will be introduced in the spring also in Western Canada. So that module is based on the information that Kaylee just indicated. But of course, we need to know then what cows did get clinical mastitis during the lactation. So the information needs to be current, and farmers need to participate in the DHI and also have a frequent measurement of the somatic cell count.
Mhm. Yeah, and all of that makes sense. So just again to clarify, so what was the threshold you were thinking of in terms of farms who should consider selective dry cow treatment? Is it a specific SEC for the bulk tank, or just in terms of, environmental management and other management practices?
So if I can, we have submitted a project to look at that. And we hope to hear next week whether that is funded, and then we are going to look at 80 Alberta dairy farms into selective dry cow treatment and selective treatment of clinical mastitis as well, because that's the other way of decreasing the use of antimicrobials. We have, I think, quite good data from other countries right now, and also some data from Ontario, how to select the cows. How to select the farms, that is more difficult. We don't have good indications for that. But one of the indications is, of course, how hygienic does the farmer work at drying off the cows? That's very important when you are going to do selective dry cow treatment, and when you're going to implement an internal teat sealant. And then, of course, the percentage of cows infected is really important, and also the way of identifying whether these cows are infected.
Great, thank you. And I will mention that when we send out this video, there is a fact sheet resource that DFC has created, I think with the Canadian Mastitis Network, specifically around dry off treatments. So in terms of keeping them as hygienic as possible. So I think that's really good to highlight. So other than the antibiotics and which cows get them, go ahead, Herman.
And just to, you're going to cut this anyway, there will be a workshop together with LAC on selective dry cow treatment in the spring.
Okay, great.
Yeah.
And no, don't worry, we won't cut it.
Yeah, I know.
So what I was going to ask, so other than the antibiotics and which cows should receive them, are there products that you still recommend that all cows receive? So such as the teat sealants, even if you're not going to treat them with antibiotics, should all cows that are drying off receive a teat sealant or a product like that?
So so that's all research projects on teat sealants have been positive towards teat sealants. So yes, it is important to use the teat sealants. We have had some problems in the past, and I just heard that some herds in Alberta have that again with black specks in cheese particularly. But the salespeople for the milking machines, they should know how to take care of that. So there are ways of getting, because there still will be some teat sealant that will come out in the first 10 days after calving. And that will, if we don't clean well enough and if we don't filter the milk well enough, that could get into the bulk milk. But there are very good procedures for that, so we should be able to avoid that.
Okay, yeah, that's really good information. So otherwise, is there any other products you're aware of? So there's some, research is always going on into new products. So an example I'll use specifically is the chitosan hydrogels. So are you aware of any research of kind of up and coming new products that look exciting?
There are exciting products coming, but not at a phase that it can be used for drying off dairy cows. Mm-hmm. So there are indeed products tested and lots of them, but none of them at the phase that we can recommend using them on dairy farms.
Okay. So I guess my last question on this topic is just to talk a little bit about the specific projects that are ongoing in your group. So what can we hope to learn from you in the future? What's happening there?
Maybe Kaylee, you want to tell about the project we hope to start pretty soon on selective dry cow treatment and on selective treatment of clinical mastitis.
Yeah, so essentially what our group is trying to accomplish is, we can talk about what we find in the literature for recommendations for selective dry cow therapy, as well as selective clinical mastitis treatment and how to reduce essentially unnecessary antimicrobial use on farms. But what we really need is specific data that's, contextually relevant to our farmers and who we're trying to speak to. So what we're trying to do is have recommendations that are applicable to, Western Canadian producers. So we're really trying to get, a lot of data from our producers to evaluate, how should they be drying off their animals with respect to antimicrobial treatment and teat sealers, like we talked about. Sort of what threshold should be enacted at the herd level, as Herman said, who should be trying this on their farm, and then not only evaluating it short term, but seeing what the impacts on the farm are, with production parameters and health parameters in mind. What are the impacts long term? And what the other thing that project is trying to accomplish is really see what the impact of clinical mastitis treatments and dry cow therapy is on the development of antimicrobial resistance. So trying to see if these products are contributing to bacteria developing antimicrobial or antibiotic resistance, and really how to mitigate that. So does dry cow therapy, for example, represent a way to help reduce the development of resistance on farms? So that's really the long-term goal of the project that Herman mentioned in particular. So essentially come with recommendations for, dry cow therapy in this part of the country, and really look at what is the contribution of dry cow therapy to resistance and how to really to mitigate that.
Great, thank you. Is there anything else, Herman, that you wanted to mention in terms of other projects that are ongoing?
Oh, there's a lot ongoing. Yeah.
There always is for you.
Yeah. So we have with, and if I say we, that's really also Kaylee and also Ellen de Jong. They have been instrumental in putting projects forward on surveillance and control of infectious diseases in Western Canadian dairy farms. That's the CHESS project. Mm-hmm. We're waiting for the funding decision in the Agricultural Funding Consortium right now for Alberta. We have submitted the project in Manitoba, and we're working with Saskatchewan and British Columbia on these projects as well, because I think it's essential that the dairy farmers in Western Canada will work together on these kind of projects. And I know that it's also a vision of all the 4 dairy boards in the project. With we the Western DRECA, I think it's called.
Yeah, WDREC, yes.
WDREC, yeah. And so in this project we're going to first look how many farms are infected with certain diseases. And that is, of course, Jony's disease, but also Neospora caninum, Salmonella, Dublin, leptospirosis. There's the whole gamut, the mastitis pathogens, Mycoplasma staph aureus, Strep A galactiae. So all kind of infections that we find in Western Canada. But it's very important, if you want to prioritize, to know how many herds are infected and how many cows are infected. Mm-hmm. So, and then we not only going to look how many herds are infected, but also how many cows within a herd. And then we are going to ask farmers whether they're interested to control the diseases in their herds and make sure that the best control practices will be tested under Western Canadian circumstances. So that's one project that we are trying to build. It's not easy because in every province we have to go for funding, for cap funding from the dairy boards, but we will get there. because we have very good team and also very positive people in the dairy industry to work with, proactive people. So another project that we are working on is detection of clinical mastitis in robot herds. We are now in Western Canada at about 25% of the farms have milked their cows with a robot. So these cows are not being seen anymore every day by the farmer at milking. So we need other ways of also detecting that these cows have clinical mastitis. And particularly the ones that have severe mastitis, because these need to be treated pretty quickly. So Ali Nakvi, one of the graduate students, is working on that, and it's a project together with the group of Trevor de Vries at the University of Guelph. And by the way, the project that I just mentioned on the surveillance, we have people involved from the University of Saskatchewan, that's Chris Luby, and of the University of Manitoba, that's Kees Plezier, and at the University of British Columbia, that's Nina von Keiserlink and Dan Weary. So this is really a joint project. Then we have started a project on what we hope eradication of Jony's disease. So in the last 10 years, the diagnostics have developed Jony's disease, and our group has discovered that calves have a very important role in the transmission of Jony's disease, which has been missed in the last 50 years in trying to control Jony's disease. And because of that, we had a lot of frustration. So we think that by including the calves now in the control and also having the improved diagnostics, that we will be able to eradicate the disease on dairy farms. So we are going to try to do that in Alberta on 10 dairy farms. Another project that we're doing, and that's a collaboration also with MSD, is communication of veterinarians with farmers. We're trying to improve the communication of dairy veterinarians. So we're working first on the baseline, then we train them, and while we also have controls we train the veterinarians in communication. And then we'll see whether the communication improves, but also whether the farmers are becoming more satisfied with the veterinarians, and also whether at the end the health of the herd actually improves. So that's another one. We have other projects in the pipeline, and one big project that I'm also running is the AMR, the Antimicrobial Resistance One Health Consortium. It is a project of $16 million with quite some funding, $6.5 million from the Ministry of Jobs, Economics and Innovation. And that's a One Health project. So that means a project where we look at the health of people, animals and the environment. And there are 28 projects in there. It's a 5-year one, and if people are interested, we have a very nice website for the AMR One Health Consortium.
Perfect, and we'll talk a little bit more about that in our next section of the interview as well. Okay,
and then of course I have my COVID-19 projects. We're working with the outbreaks in all kind of parts in the world.
And so, Anna-Marika, I'll bring you back in. And could you talk a little bit about your project and the impacts it might have on, health in general? So maybe not specifically to mastitis, but general animal health moving forward.
Yeah, I could do that. I mean, we still have to plan everything for this project, right? But basically what we're hoping to do is to look at first what are the most commonly used outdoor areas in Western Canada. So we know pasture, but we also know that pasture isn't always feasible on all farms. So people have used outdoor straw packs or dirt lots. and to see which of the, we want to basically make a comparison between the pasture areas, but also alternative outdoor areas that are most used. So for example, dirt lots or the straw bags, to see what the effects are on various key health outcomes, such as Herman already said, lameness, but also clinical mastitis. And from the focus group studies that we did, is one thing that came out as a big question mark from many producers was, well, it's hard to provide my cows outdoor access, especially pasture access. However, alternatives are sometimes easier, and especially for animals that you don't have to bring to the milking parlor every day. So especially the heifers and the dry cows. So then there's lots of research on dry cow health in indoor housing systems, but there's not much research on even pasture access, let alone alternative outdoor areas. So that is something that I think would be something to prioritize, to investigate what outdoor access, various types of outdoor access does for dry cow health.
Great. Well, I think that kind of covers up our discussion on dry cows and the dry cow treatment. So thank you very much, everybody, for that. So is there anything else you wanted to say regarding dry cows and the dry cow treatment before we move on?
Yeah, I just wanted to add that while we're looking at what the impacts are on farms for selective dry cow therapy and selective clinical mastitis treatment, we're also really taking into consideration the economic impacts for producers. So essentially, we'll be utilizing the data that we're gaining from this project and doing an economic analysis to see essentially what is the most beneficial dry cow management way for producers to enact moving forward. The same economic analysis will be considered for the CHESS project, the disease control project that Herman mentioned as well. So not only are we really considering like dairy sustainability in the sense of disease control and cattle welfare management, but we're also really considering it from the perspective of producer economics and ensuring that what our recommendations are actually feasible for the producers to enact.
Great. And yeah, thank you for bringing that up, because I think it's really important that we show our producers that we're trying to keep that, we have them in mind and we're trying to keep it practical and trying to consider, what works best for them as a business and as well as for the cows. So that's really important for research.